Hi everyone, this is Neil Writer, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with really itchy and irritable ears, and you may have noticed that they've been scratching the entrance of their ear canals, quite sore and red there. This patient has to attend every 9 months on the dot, and what we actually do is after each appointment we schedule them in advance for their 9-monthly appointment and just remind them a few days prior. I do ask this particular patient to instill some olive oil medical grade spray just the day before to soften the surface of the wax, and that's because historically the patient's earwax is really hard and dry and crusted, and the exterior surface of it's almost like sandpaper, and as we're removing the wax the patient finds it slightly uncomfortable because it grazes the side of their ear canal. And so the olive oil just helps to lubricate the canal wall and soften the surface so it's not as rough and sharp as we're bringing it forwards. I'm just using an ear hook here, and as the video continues you will notice, and I will highlight it to you, this patient has a bit of fungal spores growing and developing on the earwax itself. Fungus can actually feed on the earwax, and so they've got a strain of fungal infection called Aspergillus niger, which a characteristic of is fungal spores. They can either be black, yellow or white in appearance, and also these woolly strands, and that's, the latter is what the patient has got. Now, one of the other key landmarks of a fungal infection is extremely itchy ears. Now, even if you have a bacterial outer ear infection, so bacterial otitis externa, that can also lead to itchy ears. And indeed, in this particular case, the patient's earwax, because it's so dry and rough, that can also cause itchiness. But when you've got extremely itchy ears, it's more likely to be a fungal infection, because it's just one of the symptoms of having a fungal infection. With a fungal infection, the patient needs to use antifungal solution drops. They are available over the counter actually in the UK. We have notified their GP as well. Quite often, probably a bit too often, patients with fungal infections are prescribed antibiotics. I had a friend today who contacted me. I treated their daughter a couple of months ago, and I felt they had a fungal infection. I requested that their GP take an ear swab just to confirm that, to ensure it is a fungal infection and not bacterial, and therefore give the appropriate medication. That wasn't the case. They were prescribed antibiotics. The fungal infection actually got worse, because when you take antibiotics, it's going to not only kill harmful bacteria, but it can also kill some normal healthy bacteria that lives on the surface of the skin that lines the ear canal, on the skin flora. So on the surface of the ear canal, on the skin, it's got its own ecosystem. It's full of bacteria, and healthy strains of fungi. You can just see that there, the white woolly strands are feeding on the earwax, protruding outwards. And if you take antibiotics, you're going to kill some of those, which then gives the fungus free rein to colonize. It's got no competitors. And so this patient's fungal infection actually got significantly worse, and they developed a really swollen, inflamed ear canal, and they had to visit an ENT doctor to get some steroid cream applied into the ear canal. So it's very important when treating ear infections that we know what we're treating and we give the appropriate medication, because it